Hi, my name is Ben, and in this section we will be discussing the embryologic process of nephrogenesis. It's a progression from one bizarre term to the next, but don't get your ureters in a twist, because we're going to break this down in a logical stepwise fashion. As we go through this section, I will point out high-yield topics and discuss what can go wrong in the developmental process. I will also explain the main role of the fetal urinary system, which is to do what again? Correct. Produce urine to supplement the volume of amniotic fluid. So with that, let us flow on down to renal embryology. The kidneys are derived from intermediate mesoderm, which is also known as the nephrogenic cord. The mesoderm is what supplies the meat of our body's final form. Quickly, what are some tissues you know originate from the mesoderm layer? Muscle, bone, connective tissue, cardiovascular system, and lymphatics are just a few. Now, the nephrogenic cord spans from the cervical to the sacral regions of the developing fetus, eventually giving rise to the three stages of the fetal kidney, the pronephros, mesonephros, and metanephros. The pronephros exists in the cervical region and will eventually degenerate during week 4 of development. It is considered non-functional in humans and will not form any adult remnant. The remainder of the picture shows its overall structure, with a single large capillary called a glomus that generates filtrate and passes into the coelom, which is the embryonic body cavity. This filtrate eventually passes into special tubules called nephrostomes, before passing into the pronephric tubules and the pronephric duct. In a human fetus, it is self-contained and will never secrete any urine. Once the pronephros degenerates, the mesonephros will develop and function as a temporary kidney for the first trimester. This is a key concept and is often tested on boards. The mesonephros, although transient, is the first functional unit of the fetal kidney. Each tubule has its own glomerulus, from which these tubules will filter blood and produce urine, therefore adding to the volume of the amniotic fluid present in the uterus. Although its role as the fetal kidneys is brief, the mesonephros will continue to serve a purpose elsewhere. Can you think of other structures it will eventually give rise to? That's correct, the vas deferens and epididymis. And what do these structures do? The epididymis stores sperm, and the vas deferens transports sperm from the epididymis to the ejaculatory duct. This is partially why the pelvic anatomy is often referred to as the genitourinary system, due to their proximity and common embryologic origins. In this way, any pathology associated with the mesonephros might also affect the function of the male reproductive system. This concept of one organ system defects affecting a different organ system's function is commonly tested on step 1. The metanephros first appears in the 5th week of gestation and will go on to develop the permanent kidneys. The metanephros is essentially derived from two separate structures. What are they? The ureteric bud and the metanephric mesenchyme. This mesenchyme may also be referred to as a metanephric blastema or metanephric mesoderm in some texts, but to stay consistent with your first aid book, we will call it the metanephric mesenchyme. It usually happens right about now where I think to myself, I'm almost positive this test will be in English, but for some reason I feel like I'm learning a different language. Did this book come with a translator? Well, no, in fact it did not, but here's a quick diagram that will hopefully clear all this up. Let's go ahead and run through this next image, which is found in your first aid text. At the top, we see the degenerated pronephros. Do you happen to remember when this occurs? That's right. It occurs around week 4 of development. Further down, we see the mesonephros, which functions as a temporary kidney during the first trimester and later contributes to the formation of the male genital system. And finally, at the bottom of this image, we see the metanephros, which is formed from two different structures, the uteric bud and the metanephric mesenchyme. The uteric bud will go on to form the tubing of the kidney, including the ureters, pelvises, calyces, and collecting ducts. It is derived from the caudal end of the mesonephric duct and will fully canalize by week 10. One important thing to note is that the uretopelvic junction, or where the ureters connect to the renal pelvis, is the last to fully canalize. Because of this, it is the most common site of obstruction, and if present, can lead to hydronephrosis as seen on prenatal ultrasound. The uteric bud eventually moves laterally to join with the metanephric mesenchyme, and both of these together will form the metanephros. This interaction is paramount, and any abnormalities in signaling or development can result in severe congenital malformations. For example, one of the many transcription factors involved in this process is derived from the WT1 gene, which is sent from the metanephric mesenchyme to the uteric bud during development. Abnormalities involving the WT1 signaling pathway are linked to an increased risk for the development of the most common renal pediatric cancer. Do you remember what this is? That's correct, Wilms tumor. It most often affects children between the ages of 2 and 4 and presents with a palpable flank mass. Time for a flash quiz. What adult structures in the urinary tract are derived from the mesonephric duct? Answer: the collecting ducts, calyces, pelvises, and ureters, which are all formed from the uteric bud, which is an extension of the mesonephric duct.